Good day, everyone. So, our topic for today is Down syndrome. So, before we begin, let's talk about the learning objectives. So, first, we will define what Down syndrome is. Next, we will learn the cause of Down syndrome. Thirdly, we will learn how often a person may acquire this condition. And lastly, we will learn how a child with Down syndrome may present themselves. So, let's define what Down syndrome is. Down syndrome is a congenital disorder arising from a chromosome defect which may cause intellectual impairment and physical abnormalities. So, specifically speaking, the chromosome that is affected is the chromosome 21. So, to further explain, I will talk about the etiology. So, the etiology for Down syndrome is genetic, since the one that is affected is the chromosome 21. So another name for Down syndrome is trisomy 21. So here, trisomy 21 accounts for 95% of Down syndrome cases. So what happens is, instead of the usual 2 copies of the chromosome 21, patients with Down syndrome have 3 copies. Thus, there is an extra chromosome 21 causing Down syndrome. Then second is mosaicism. So here, what happens is the chromosome 21 appears on the other chromosomes. So, just like a mosaic, right? So, lahi og color or different colors. So, in mosaicism, instead of just, let's say, chromosome 10, 11, and 12, they have pieces of chromosome 21. Thus, it becomes a mosaic. So this accounts for approximately 1% of Down syndrome cases only. So this is very rare. The next is translocation. So translocation accounts for 4% of Down syndrome cases. So here what happens is the chromosome 21 breaks off and connects to another chromosome. So usually the chromosome that it attaches to is chromosome number 14. So here in translocation, although Down syndrome is not hereditary, if a parent has the translocation gene, so here there is a chance that their children will also have Down syndrome. So only if it's translocation ang cause sa Down syndrome, no? That's the only time that it can be passed on. The next is, let's talk about the prevalence and incidence. First, if there is an increase in the mother's age, this leads to an increase in a risk for having a child with Down syndrome. So if a mother is more than 35 years old, then the risk for them or for their baby to have a Down syndrome increases also. So 1 in 1,000 babies that are born have Down syndrome. Then there are 600 cases annually. So next, if there is an increase in the increase in lifespan causes the increase in the cases worldwide. So maybe you're asking, what is the relationship of lifespan and Down syndrome? Diba? So, as I've said earlier, an increase in the mother's age increases the risk of having a baby or a child with Down syndrome. So, in the past decade, since there is an increase in lifespan, there is also an increase in the cases. Okay? Diba? If a mother has an increased lifespan, there is a chance that they also want to have a baby despite being old. So, since maybe wala pa sila nagbinopose, so they try to have a baby. So, thus, there is a bigger chance nga Down syndrome, nga naay Down syndrome ilang baby. So, that is the relationship of the increase in lifespan and the increase in cases of Down syndrome. Now let's talk about the signs, symptoms, and pathomechanics. So for the signs and symptoms, they usually have flattened face, small head, short neck, macroglossia, which causes protruding tongue. So if you're not familiar with macroglossia, so this happens or when the tongue is too big for the oral cavity, or basically they have a big tongue, so it is too small for their oral cavity rather is too small for their tongue. Thus, ilang i-protrude ilang tongue kay they can't hold it man because it's too big. Then they have unusually shaped small or small ears. Then next, this is one of the major characteristics of patients with Down syndrome. So remember this one, they have poor muscle tone. So later I will expound more on poor muscle tone in the other areas. Then another signs and symptoms in children with Down syndrome is broad, short hands with a single crease in the palm, relatively short fingers, and small hands and feet. So usually kids with Down syndrome have small fingers and very chubby ilang fingers, no? Then they have excessive flexibility. So this is in relation to their low muscle tone. The next is they have short height. The next, they may have mild to moderate intellectual disability, and some may have congenital heart defects. But remember, these are just some, no? So these may or may not occur in patients with Down syndrome. However, ang ilang physical features usually same ra gyud na. The next, let's talk about the pathomechanics. So neutrophins and immune system pathways are disrupted in patients with Down syndrome. Thus, they are more prone to obesity, autoimmune disorders, diabetes, hyperthyroidism, and gastrointestinal problems. So, let's first talk about the neutrophins again. So, neutrophins are proteins in the brain that help to regulate the growth and synapses of the neurons. So, since affected ang neutrophins o ang ilap yung immune system, mao na nga medyo mas prone gid sila og mga diseases ang kids with Down syndrome. So next, let's talk about the characteristic speech and language problem. So first, let's talk about speech. So for their speech, usually they have delayed acquisition of speech sounds and articulatory errors. So why man? Going back sa kadtong low sila og muscle tone, no? So first is delayed ang acquisition of speech sounds. So since delayed ang ilang since low ilang muscle tone, meaning weak, di ba? So maglisod yun sila og produce or ingon sa sound. Muna nga ang ilang pag-acquire sad ma-affected sad, so ma-delay sad kay ang movement itself they can't do it yet due to their muscle tone. So that also applies to the articulatory errors. Another factor is katong macroglossia. So since their tongue is too big, structure wise maglisod sila og produce sa sound. So articulatory errors occur. The next is sa language. So for language, they may have language delay or language disorder. So why again? So again, since diba sa speech sounds palang daan, maglisod na sila og acquire how much more ang sa words. Then also kay diba as I've said earlier, some patients with Down syndrome have intellectual disability sad. So this is also a factor on why language delays or disorders may occur. Some children with Down syndrome are also non-verbal. Then next is good silang pragmatic skills. So here, what happens is ang kanilang kids kay they are very friendly, no? Usually if mo talk ka with them, they will likely respond, or sometimes they will be the first one to interact with you. It's just that some of the kids with Down syndrome have difficulty expressing themselves, but this is not applicable to all, no? Kaya na may uban sad nga kids with Down syndrome nga very verbal and ma-understand good sa nga giingon. Nasa uban nga non-verbal, nasa uban nga di kayo masabtan ang ilang iingon. So they are unintelligible sad. Then next is hearing and feeding. So for hearing, some children with Down syndrome are born with hearing loss. So this also affects acquisition of language skills. Okay, diba? We need to hear an input before we can produce an output. So that is how we acquire language, from hearing input from others. So mo na nga other children with Down syndrome kay affected na lang hearing, so affected sa ang ilang language. The next is the feeding na sad. So here, 50 to 80% of feeding issues occur in children with Down syndrome. So why man? So this is due to their low muscle tone. So this causes respiratory problems, gastrointestinal problems, and also cardiac issues. So, di ba? Since low sila og muscle tone, so weak ilang muscles. So, if mukaon sila, weak sad ang movement sa ilang oral cavity. So, mo na nga naay feeding issues, di ba? Kay if mukaon ka, then weak pa ang muscles nimo. So, ang food dili sad sakto ang movement, di ba? So mo na nga mocker ang feeding problems. The next is oral motor deficits. So here, this includes poor sucking and poor lip closure. So again, why? So due to their low muscle tone. So maglisod sila og close sa ilang lips, maglisod sad sila og suck. So this causes uncoordinated swallow, which may lead to choking, gagging, and coughing. So mo na siya nga naasay feeding problems ang children with Down syndrome. And lastly, behavioral feeding concerns. So some kids with Down syndrome have oral defensiveness. So mo-avoid sila og kanang mga different sad nga textures, no? So kani kay still it's not applicable to all patients with Down syndrome. However, some kay kana applicable na siya nga naa sila behavioral feeding concerns. So that is the end of my report. So if you have questions or clarifications, feel free to email me at my Gmail account that is flashed on your screen. So I hope you learned something from me today, and please listen to the part 2, which can be found in the channel also. Thank you everyone, and have a good day.
Hello everyone, and welcome to the second discussion for the condition named Down syndrome. Now let's get into the objectives first before we begin. We are going to be discussing the types of Down syndrome, its course and prognosis, the possible management, and lastly would be the support systems here in the Philippines for individuals with Down syndrome. Without further ado, let's get into it because it's a really interesting set of topics. All right. So, what are the types of Down syndrome Exactly. So if you see, there is actually a ribbon that's colored blue and yellow on the bottom left corner of the screen. And this is actually a ribbon that people use to signify support for individuals with trisomy 21. Trisomy 21 is actually one of the types of Down syndrome, and we will get into this even more now. So, how many are there? People maybe think there are just like two, but actually there are three. There are three types of Down syndrome, and these will be namely number one, trisomy 21, second would be translocation, and third would be mosaicism or mosaic Down syndrome. Okay, so these are the three types, right? So we'll be discussing them one by one, and we will begin with trisomy 21. Trisomy 21 occurs when there is an extra chromosome within a person's group of cells. Now, different types of syndromes may occur if there is an extra chromosome within them. As you may see in the picture flashed on the screen, if a person has an extra chromosome within the 13th chromosome, it may occur to be trisomy 13 or Patau syndrome. Now, with trisomy 18, this may be named Edwards syndrome. And lastly, trisomy 21, none other than Down syndrome. Okay, now this is the most common form of Down syndrome, and it comprises of 95% of individuals with Down syndrome. This is according to the CDC in 2020. And actually, this is, as what I've mentioned before, it occurs when there is an extra chromosome for chromosome 21, and each cell in the body is expected to have 2 copies, right? And not 3. Now, going back, before we delve into the 2 other types of Down syndrome, how exactly are we supposed to differentiate the types from one another, especially when we are in the field? Now, actually, if you want to differentiate the different types of Down syndrome, you would have to go to a geneticist, and also you would also have to get a blood test in order to see the different chromosomes and the different genes that may arise within an individual. All right, so now that we're into it, let's talk about translocation and mosaicism. Second would be translocation. Now, translocation occurs when this happens within the picture, and another description would be provided. Coming from the word translocation, it means that an extra chromosome or a part of the chromosome from chromosome 21 rather transfers or locates itself at another location, right? So here it is on chromosome 14, and from here we can see that it actually comprises of 3% of the known population. Now, to describe it further, an extra part of the chromosome 21 is present but translocated to another chromosome. It attaches to chromosomes namely 13, 14, 15, and 22. This is according to the Stanford Children's Health website in 2021. Okay, so now that we're done speaking about translocation and trisomy 21, what was the last one again? It was mosaic. Now, mosaic occurs in 2% of the known population, and it is a mixture or combination of different types of Down syndrome. Now, typical and atypical copies of chromosome 21 are seen, and within this type of Down syndrome, less pronounced features may be seen. Alright guys, so now that we're done speaking about the types of Down syndrome, let's go into the course and its prognosis. Okay, so let's talk about it generally first. So, within children, DS is known to progress at a slower, children with Down syndrome are noted to progress at a slower rate generally. And adults also experience accelerated aging. Now, let's get into the different populations, and let's speak about the children first. So, children go forward in their development, however, progress is at a slower rate. And one thing that we should look into, especially when handling children children with Down syndrome, is early intervention, because it is important and beneficial for children with Down syndrome. Now, if you see in this table provided by the NDSS, these are the differences between typically developing children and children who are functioning with Down syndrome. Now, if you see their gross motor skills are quite different from develop rather slowly uh, compared to typical age ranges, and also their language. What the most evident here, especially for Down syndrome, would be slow developments within their gross motor skills. And however, coming from experience, actually, individuals who function with Down syndrome actually have very vast um, receptive language skills. So they understand the different concepts that are expected for each age range. However, they have difficulty providing verbal means of communication because of their delayed motor skills, rather. And this may also be seen when they have difficulty with walking, and when they may have difficulty with their fine motor skills, especially when they begin to write. So yes, and these development issues may also be seen in different aspects, such as social skills, which may be seen when they have responsive smiles and they finger feed, and also when they use utensils, and so on and so forth. Now, if we talk about the adults actually experience accelerated aging, and they experience certain conditions by the ages of 40 to 50. Now, this is largely related to genes. Sorry for the typo. This is largely related to genes in chromosome 21 that are associated with aging. Now, what are the types of conditions that individuals within the geriatric population? Let me rephrase that. What are the certain conditions that they tend to experience? Now, this would be your sensory loss, osteoarthritis, osteoporosis, celiac disease, Alzheimer's disease, cervical spine concerns, hyperthyroidism, and obstructive sleep apnea. What can we do with individuals with Down syndrome? As what I mentioned before, early intervention may benefit in their overall functioning. And lastly, several medical conditions may arise due to aging. Okay, so now that we're done discussing about the course and prognosis for Down syndrome, let us talk about management now. Who can help? Well, there's one profession that I would like to focus on, and it is the profession that we are studying to work in. Now, that is speech and language pathology. So, one set of professionals that can help individuals with Down syndrome would be your speech and language therapists. Now, the ultimate goal, as cited by Ray Paul in 2011, is to improve functioning in these areas: communication, academic wise, social, and vocational. So this is the target for us speech language therapists, right? So we focus on early intervention, the preschool years, school age, adolescence, and all stages, nonetheless. Okay. Now these are a set of things that we may do for individuals with Down syndrome. So if you see the different areas, we focus on exercise programs, muscle programming, and coordination level. We may also look into speech production level, their pragmatic and language level, and assistive technology needs. Now, what are assistive technology needs? These are your augmentative devices, which you will learn further in AAC in the future. Okay, so let's talk about the different things specifically. So for exercise programs, you guys may consider, especially with individuals with Down syndrome, you may consider oral motor muscle strengthening, intervention for feeding problems, intervention for tongue thrust or swallowing problems. Now, for muscle programming, we may also intervene with developmental apraxia of speech or oral apraxia. And for speech production, we may also look into articulation therapy, phonological processes, the treatment for the volume and loudness of our voice, which also looks into resonance and rate control, prosody treatment, and lastly would be fluency therapy. We have a lot of things to tackle in terms of speech production level because, as I mentioned, individuals with Down syndrome have difficulties with their motor skills. And if we look into the pragmatic or language level, we also treat nonverbal factors and we also look at the language skills that impact intelligibility and also communication interactions in school and the workplace. Because us as speech language therapists, we want our patients to have functional communication skills in order for others to understand their needs and wants, right? So, yes. Okay. So let's look into the other things that we may treat with individuals who are functioning with Down syndrome. So I will discuss further the different things that we may tackle, especially in terms of language. So for receptive language skills, we may look at their overall language comprehension. We may look at their auditory processing skills, their vocabulary, and their morphosyntax. For expressive language skills, we will look at their vocabulary usage in terms of their increasing vocabulary skills and their divergent and convergent language skills. And we may also look at the language of the curriculum that they may be currently enrolled in order for them to use verbal communication or any sorts of communication in order for others to understand them. Okay, we may also look into morphosyntax, or we may by increasing their means length of utterance and also by increasing the complexity of their language output in order for others to understand them further. Now, we may also look into their pragmatic skills, which focuses on social interactive skills with family, peers, and teachers and other familiar adults. And lastly, would be the unfamiliar adults. Others would be communication activities of daily living, classroom routines, conversational skills, requests, and clarification strategies or repairs. We may also look into the literacy skills of the child, or the individual rather, wherein we may look at the reading proficiency, the reading comprehension, and narrative discourse. Alright guys, excited for that? Now that we are done talking about the things that a speech and language therapist may do, let's look at the different professionals who may help in the management for individuals with Down syndrome. Now, another professional would be the genetic counselor, and these genetic counselors assist the affected or at-risk families in understanding the natural history, condition risks, and the mode of transmission for different genetic conditions that may arise within families. And this is also very important for individuals who may suspect that they have underlying conditions that may be passed on to their children. And this is also one form of early intervention that may be done in order for intervention to be prepared should the need arise and also for prevention to occur. Yes. Okay. So aside from genetic counselors, individuals who are functioning with Down syndrome may benefit from the presence of physical therapists. Now, they facilitate the development of gross movement patterns and they help develop good posture, efficient walking patterns, and foot alignment. Apart from this, occupational therapists may also be very influential or helpful in the progress of individuals with Down syndrome. Now, they facilitate the teaching of self-care skills, fine motor movements, and participation in ADLs. Just a little fun fact, guys, and we actually collaborate a lot with occupational therapists, and this actually goes into self-care skills and participating in ADLs, because how else are we supposed to communicate our needs and wants and also to communicate with others when participating in ADLs such as cooking and such as cleaning and working in the workforce. Yes, and that's actually how important the collaboration between different professionals is. So yes, let's look into the other professionals that may help. So we also have the family physician, who manages the common complaints and oversees the preventive care and helps manage chronic illnesses. Apart from this, they also look into diagnosing emerging conditions that may see that may be seen as a threat or may be seen as treatable by medical care. Okay. Lastly, we have the existing support groups. Now, there is one big support group for individuals functioning with Down syndrome here in the Philippines, and this is namely the Down Syndrome Association of the Philippines. Now, this association aims to offer support to families with children who have Down syndrome, and they also initiate, develop, promote, encourage, and support programs concerning Down syndrome. And since this is the last topic of my discussion, thank you so much for listening, guys, and I'll see you guys around.